I wanted to talk about the Center for Reconstructive Urology and Men's Health. Dr. William Brandt and myself came to University of Utah in 2009, and we recognized the need for urologic reconstruction and a focus in men's health and sexual issues. We started the Center for Reconstructive Urology and Men's Health shortly after arriving, and recently Dr. Jim Hotaling has joined our staff after completing a fellowship in andrology and infertility. We see patients both at University of Utah and at the South Jordan campus, or Daybreak. I specialize in urologic reconstruction and dealing with a multitude of problems that come up in urologic reconstruction, such as urethral strictures, radiation injury from prostate cancer treatment, or gynecologic radiation, such as ureteral strictures or vesicovaginal fistula. I also deal a lot with patients with spinal cord injury or neurogenic bladder that need surgery to either remove the bladder, augment the bladder, or just treat the condition neurogenic bladder, such as treatment with Botox injections. Dr. William Brandt and Dr. James Hotaling both work in sexual health and andrology. Dr. William Brandt specializes in prosthetic surgery. This mainly involves treatment of men with sexual problems and erectile dysfunction, placing penile prosthetics, or using other methods for treatment of erectile dysfunction, and also treating men with incontinence, especially after prostatectomy or other surgeries. Dr. James Hotaling works primarily in andrology, which means low testosterone or hormone problems, and also infertility. So for instance, he treats many men that are trying to conceive children and have undergone vasectomy in the past or have other reasons for infertility. Our staff is also composed of 3 physician assistants: Kate Trueheart, Mary O'Rourke, and Robin Dale. We chose these physician assistants because of their empathy for patients, their intelligence, and their clinical competence. As a patient, you may interact with these physician assistants during an initial encounter, or they may subsequently follow you. And it's not that the physicians do not want to see you every visit, it's just the practicality of following so many complex patients with urologic reconstructive needs or sexual health issues. I can assure you that if you see one of our caring and very competent physician's assistants, that they're in constant communication with us about any problems that arise. We're constantly in the background coordinating care with physician's assistants, and will quickly step in if the care becomes more complicated than they're comfortable with following. In addition to the physician's assistants, the clinic employs a nurse and multiple medical assistants that will check you into clinic, talk to you on the phone about problems, and relay messages to either physicians or the physician's assistants that I mentioned. These individuals have been chosen again because of their empathy, their energy, and their competence. The other important staff in our urology clinic is the surgical coordinators, Elizabeth and Marissa, and several other coordinators that you may speak to on the phone. These individuals will coordinate surgery, relay problems that you're having before and after surgery, obtain records, and obtain important x-rays that might be needed before you come into clinic to see us. We handle many patients from all over the Rocky Mountains and the Intermountain West. Patients come from Montana, Wyoming, Idaho, Nevada, just to mention a few. When patients are coming from very far away and they have complex urologic reconstructive needs, it's often very helpful to speak on the phone before the patient arrives. These phone conversations can be arranged through the surgical care coordinators. I personally like to do these conversations when patients are coming down and hope to see us in clinic and then obtain surgery in the coming days. It's very important to set up expectations with the patient about what can be done for their problem and also to make sure that everything has bin coordinated for their visit, so it's feasible to do a surgery as well as a clinic visit in the same setting. We pride ourselves at the Center for Reconstructive Urology and Men's Health in taking a very caring and empathetic approach to our patient care. The patients we see in urologic reconstruction often have very complex problems, and we need to come up with a plan that makes sense, has a good expectation of success, and will restore a quality of life. Patients may not achieve total normalcy. However, we want the quality of life and the improvements we make to make sense to you and have a logical progression. We follow many, many patients and see many patients each week with complex problems. Our clinic, we strive to see patients in a timely manner and also take all of the caring and all of the time that's needed. So please be patient if you find the clinic waits are longer than expected. We try our best to get every patient the care that they need, and also to come up with a logical plan if surgery is needed, one that a patient understands fully. Please let us know if we can improve anything about our clinic experience. And we hope that your visit to the Center for Reconstructive Urology and Men's Health will result in good information, a good surgical plan, and if surgery is needed, restore a very good quality of life for the problem that you have.